July the 11th. Thousands of angry people converge on the capital. Today, the doctors and their allies must force the government to give in or lose the strike. Afraid of trouble, both the CCF and the police have men in plain clothes among the crowd.
We are here to say that this is a bad law.
The government lies low, waiting to see if the rally gathers steam. Trying to force a confrontation, Ross Thatcher marches into the building. The chamber is locked, so he has his picture taken trying to kick down the door. He thunders that Saskatchewan is turning into Cuba or Russia. But despite its enthusiasm, the crowd is smaller than the doctors hoped. The rally leaders hand a petition to Health Minister Davies and go home. Premier Lloyd and his colleagues realize the momentum has shifted in their favor. Lloyd decides it's time to bring in a fixer to end the strike. The man he chooses is Lord Stephen Taylor from London. Thatcher dubs him Lord Haw-Haw, but the eccentric Labour peer is not only a physician, he's also one of the architects of Britain's National Health Service. The doctors fear that if they don't go back, they will lose their patients to the British replacement doctors or to a new form of socialized medicine. Support for Medicare becomes more vocal. July 18th. In a brave move, the doctors show up at a CCF convention.
We have seen an attempt to intimidate and to blackmail the government and the people of this province into repealing and rescinding legislation which the great majority of the people have voted for.
After listening to Douglas denounce them, the doctors send their spokesman to the podium.
The Council of the College has authorized me to put forward a new proposal, which, in essence, involves prompt amendment of the Act and the simultaneous action of the College in urging members to return to private practice.
For 5 days, Lord Taylor, whose specialty is psychiatry, shuttles between the two sides. Then, on the last morning, as he is in his bath at the Bessborough Hotel, word comes to Lord Taylor that the doctors will sign the agreement. July 23rd. The strike is over. The doctors go back to work. The acceptance of universal, publicly funded health insurance for all of the province's 900,000 people. By 1970, following Saskatchewan's lead, all the provinces in Canada have brought in comprehensive Medicare programs.
The second is, again it's been mentioned, to save Medicare from subtle strangulation. Our friends in the United States are spending 9% of their gross national product. And they get a higher per capita gross national product than we do. They spend 9% of their gross national product on health care, and 34 million of their people have no health care coverage. And in Canada, we spend 7% of our gross national product, and every man, woman, and child in Canada is covered under Medicare. But I want to warn you, as one who started out even before I was in politics, dedicated to the idea of comprehensive health insurance, fought for it through all my political life. I want to say to you that Medicare and hospital insurance are already marked for destruction unless you stop the per capita taxes and the extra billing which most of the governments of Canada are now permitting. It means that increasingly the people who can afford to pay the per capita tax and the people who can afford to pay extra billing will pay it. And they will get the best care. They will get the most experienced surgeons and physicians. They will get into the best hospitals. And the people who can't pay, they'll take what's left. If you want a two-tiered health program, then just continue the way we're going. And I remind you that in this movement we pledged ourselves 50 years ago that we would provide health care for every man, woman, and child, irrespective of their color, their race, or their financial status. And by God, we're going to do it.